Fellow Kenyans, our porous borders are the ones that have become the latest high-risk areas in the transmission of the disease. And the borders are now our key area of focus. On Tuesday, we informed you of a technical team that was sent to Namanga border on a fact-finding mission. The objective of this team was to assess the situation and to recommend interventions, particularly for truck drivers who are now becoming another weak link in the fight against the virus. In our daily updates, we have informed you of the cases that continue to come from our border points, particularly Namanga. Yesterday, as you're all aware, we recorded 47 new cases, 22 of them being Kenyans, while the remaining 23 were Tanzanian nationals. At another border point of Isebania, Migori County, we continue to witness emerging positive cases. The government is closely monitoring these developments and putting in place intervention. We do appeal to our communities living within and around our border counties to actively exercise the Nyumba Kumi community policing. We should be vigilant and we should report any suspicious individuals who may use Panya routes to get into the country. Turning to our situation as pertains to the COVID-19 pandemic, we have tested 1,486 samples in the last 24 hours, bringing to total the number of samples tested to 36,918. And from the samples tested today, 21 people have tested positive for COVID-19 disease. And all these 21 are Kenyans. The youngest is 7 years old, whereas the oldest is 79 years old. 14 are male and 7 are female. And 4 out of this number are truck drivers who are tested at the Namanga border. Out of the same samples, 8 individuals were truck drivers from Tanzania who also tested positive and were referred back to Tanzania. 7 at the Namanga border and 1 at Isebania border. The 21 Kenyan cases are distributed as follows: 12 cases from Mombasa, 4 from Kajiado, 4 from Nairobi, 1 from Uasin Gishu. And therefore this brings the total number of those who've tested positive in the country to 758. The positive cases are also spread out in the estates as follows. In Mombasa, Likoni has 5 cases, Mvita 4 cases, Jomvu 2 cases, and Nyali 1 case. And in Kajiado, 3 are from the Namanga border point and 1 from Loitoktok. And in Nairobi, 4 of the cases are distributed between Isili and Kibra, with each having 2, while Uasin Gishu has 1 case from Tarbo. Today, we have discharged 3 people from hospital, and this brings to number 284 the total number of recoveries from COVID-19. And we do thank our healthcare workers for this achievement. However, on a sad note, we have lost another 2 patients, both from Nairobi County, and this brings to 42 the total number of those who have so far lost their lives from the disease. And we would like to send our heartfelt condolences to the bereaved families and friends. As we conclude, we will take this opportunity to thank all those who have provided different kinds of support to the Ministry of Health in response to this pandemic, and we encourage other well-wishers to continue extending their support. With regard to the strike of healthcare workers, again, the ministry is alive and is in discussions with different healthcare worker groups as to how this can be averted. And let me reiterate by saying, and we've said it over and over again, healthcare workers are basically the heartbeat of this response. And so we are in negotiations and discussions with them to evaluate their concerns and to be able to come to a middle ground where we can actually move forward with this. And as we do this, one of the issues that we are addressing is actually PPEs. And that's why we have 2 trucks right next to us today that are here to bring together some almost 11,000 sets of PPEs that will protect our healthcare workers. All other grievances on the table are being discussed and we're in negotiation to avert any strike on Monday.
In terms of the quarantine facilities, you remember Waziri gave his word here during the press that quarantine in government-designated facilities is free, and that directive is being implemented to the letter. Please, if you hear of any facility where somebody is charging or levying a fee, bring it to our attention so that we can be able to address it conclusively.
We'd like to affirm our commitment to continue working and partnering with the government in this fight against COVID-19. And it's a fight that we believe will be won as we see the great efforts that are underway. To this effect, World Vision Kenya has today donated 11,416 PPEs, which are worth over 50 million Kenya shillings, to the National COVID-19 Emergency Response Committee. This is really our way of supporting all the efforts that the government of Kenya has put in place. And the kits comprise of surgical masks, shoe covers, scrub bottoms, aprons, and coveralls. It is our hope that this equipment will really go towards protecting our frontline workers, whom I'd like to also thank this morning for all the wonderful work that they are doing to protect Kenyans. Domestic abuse, and especially violence on children, is on the rise. So we continue to support awareness creation to make sure that children are protected. And we'd like to request the National COVID-19 Emergency Response Committee to consider developing specific COVID-19 child protection standards of operating procedures that integrate child safeguarding guidelines.